This video is going to discuss the topic of somatic symptom and related disorders, which to summarize are anatomically impossible events, but they seem to happen anyway. So when an individual complains about physical pains or abnormalities, sometimes disabilities can occur that suggest a medical problem but do not always have a known biological cause and are not produced voluntarily by the individual, they are said to have a somatic symptom disorder or a related disorder. So the main things to note is that this disorder is involuntary, it's not biologically possible, and it can often be very sudden. So one subcategory of somatic symptom is the conversion disorder, where the individual displays serious neurological symptoms such as paralysis, loss of sensation, or blindness, which suddenly occur. And if you were to conduct some electrophysical recordings and brain imaging, you would see that people with this disorder have anatomically sound body systems and are not found to have a biological source linked to their problems. And people usually with this conversion disorder will seem to express a labile indifference, which is just a lack of concern for their neurological symptoms. So one type of conversion disorder is glove anaesthesia, where an individual loses feeling in their hands, where the area where you'd usually wear a glove, which shouldn't be possible because the nerves innervate in this entire area. There's no localized area of nerve innervation. It runs all the way down this arm. So for this person to lose feeling in just their hand is highly unusual and anatomically impossible. Another type of conversion disorder is psychogenic blindness, which is a very rare condition and where the person becomes blind suddenly. Brain scans and electrophysical recordings show that visual stimuli are being registered in the cortex and that optical pathways are not damaged. However, the individual is blind. So there was a study which found that 150 people, or Cambodian refugees who moved to Southern California to escape the killing fields of the Khmer Rouge in the years following the Vietnam War, 150 of those people were found to be functionally blind, and when they were interviewed, it was discovered that a common factor was that this blindness occurred shortly after witnessing a murder. So can we predict which individuals are more susceptible to somatic symptom and related disorders? Well, the cultural component of witnessing something so painful that the body symptoms shut down to prevent the feeling of extreme pain is one suggestion as to why these symptoms could occur. Another is that there seems to be a sort of correlation for people who are susceptible to being hypnotized and developing a somatic susceptibility disorder. So it is likely, there was a trend found that people are susceptible to hypnosis, they are also likely to be susceptible to somatic symptom and related disorders. These types of disorders are also found in cultures or environments which do not encourage expressions of emotions, such as military and police force, and may induce a somatic symptom disorder, as there is no other way to express their feelings of distress. There is also a slight genetic disposition which shows that somatic symptom disorders tend to run in families. So far we have found out that somatic symptom and related disorders encompass a category of abnormal neurological or otherwise physical disabilities which are involuntarily caused by the individual and do not have any biological cause. We had a look at conversion disorders such as glove anaesthesia and psychogenic blindness. We also had a look at some factors which may play a role in an individual's susceptibility to a somatic symptom disorder. So now we're going to take a look at a related somatic disorder, which is dissociative disorders. Dissociative disorders involve a breakdown of normal personality integration, resulting in significant alterations in memory or identity. And we're going to have a look at the three types, which is dissociative fugue, amnesia, and identity disorder. So dissociative fugue disorder is when a person completely loses all sense of personal identity and may walk away from their lives into a completely different locational lifestyle. These individuals are often unaware of these episodes and cannot step out of them. Dissociative amnesia disorder is, if an individual experiences a highly stressful event, they may selectively forget painful experiences and retain only some skills and memories. Dissociative identity disorder is when an individual has more than one personality. There is often a dominant or host personality, as well as less frequently appearing personalities, which are known as alters. Personalities may differ in gender, age, physiological appearance, allergies, memories, and skills, and some personalities may not even be aware of each other. So what causes DID? Well, it has been linked that severe or stressful events in childhood, usually physical abuse, cause DID. There was a case study of 100 people with DID, and 97 of those had an abusive childhood. And psychologist Frank Putnam believes that this is because children do not have a well-established identity and can dissociate easily, and these alters allow the pain to be distributed to an identity who can better handle the pain. So there is a controversy surrounding DID because it does not exist in some cultures, and since the publicity and televised appearance of the disorder, more cases have been appearing from an average of 2 to 3 to 15 different personalities. Before 1970, there were only 100 cases that were recorded worldwide, and after 1990, with the spur of publicity and television surrounding DID, did cases start to reach numbers in the tens of thousands. So to summarize, somatic symptom and related disorders include conversion disorders and dissociative disorders. They're all involuntary and display no biological evidence